Today, we're going to talk about the most deadly disease. I've already heard from several people that were very curious from our teaser from last week about.
Oh, okay, really?
Well, what is the most deadly disease? Like, what you mean? It's not heart disease? And
yeah.
I told them, well, you'll have to check in and find out then, I guess, won't you?
Yes. Does anyone have a guess? Anybody that's watching, leave a comment if you have a guess of what it might be. Yes. I was definitely surprised. So
yeah, in fairness, I think this is it depends on how you define things, and certainly if you Google search what's the most deadly disease, you're going to come up with heart disease. Cancer is getting close to heart disease, but what I've done in this is just taking a step back and maybe more fundamental. What is driving heart disease? What's driving cancer? What's the most common disease that we are suffering from? And, in positioning that as, okay, here's the real cause. So really just a deeper dive in the root causes of the things that kill us.
Right. Yeah. Definitely. Yeah. Cool. So if anyone has a guess, leave it in there before we start talking about it, and we'll just give everyone a few minutes to get on. While we're waiting, leave a guess and let us know how you are. We're really excited. Sorry about last week. I forgot about the time change and messed up the time zones. So if you had trouble getting on last week, that was completely my fault. And of course, Dr. Hurst is in Arizona, so time doesn't change for him. So we are now doing it. Well, I believe it would be an hour earlier for everyone. We'll now be live an hour earlier every week. Ooh, Philip just came on with metabolism related disease.
Ah, very good. Philip, yeah, either he has a special insight or he scooped us a little bit there.
Yeah.
Beautiful. That's
either way.
So that's that's actually the answer. So let's talk about this. This is the most deadly disease. I'm gonna even put out there, this is the biggest problem in healthcare, and healthcare certainly has lots of problems. And I know that's a really bold statement, particularly in a time when we are going through, unprecedented experience with a pandemic that we've had recently. But I still believe that this is the biggest problem in healthcare, and I'll see if I can explain why and see if people understand why I think it's very plausible, even in the setting these times, that this is the biggest problem in healthcare. So, what Philip had mentioned, metabolic disease is what I'm going to argue is the biggest problem in healthcare. So, most people would say, okay, well, I've never even heard of that. What do you mean by metabolic disease? And that's a fair statement, because I think this is something that is relatively new to us. It's new to us for a couple of reasons. One is that this problem, the metabolic disease problem on our health, while it's existed for centuries, is really only become to the forefront in more recent decades. Like, this has just been increasing at epidemic levels in more recent years. And then number two, metabolic disease is a complex topic. It's just a more hard one to wrap our minds around, because it's not the typical disease like, when the leading causes of death were pneumonia or tuberculosis or something along those lines. We could wrap our heads around that and see, whereas metabolic disease is really a congregation of things. There's multiple different factors that define metabolic disease, but they all work together and they're all interrelated. And that's why medicine is categorizing this as metabolic syndrome or metabolic disease. So why do I think this is the biggest problem in healthcare? Well, about 60% of us have metabolic disease, meaning that we meet criteria for metabolic syndrome when we include all the factors that go along with that. If we look at just how many of us have at least one sign of metabolic disease, research shows 88% of us as adults, and even 78% of adolescents have at least one sign of metabolic disease. So what are those? Let's define what metabolic disease is.
So real quick, if you
Sure.
have a sign, like this isn't to point, point fingers at you, like you're not alone. Like this is the majority. But the reason we're talking about this is because we need to start being more aware of, okay, what's going on and what can I do about it? So sorry to butt in. I just wanted to share that, you're not alone in this. This isn't something that it's a concern, but it's not something to feel alone in. We're here to help you figure out how to get to the bottom of this.
Right. So what are the signs of metabolic disease? There's 4 of these. And if you have any of these signs, then you may have metabolic disease. And if you have more than 3 of these, it's metabolic syndrome, but it's unhealthy weight, high blood pressure, high blood sugar levels, or unhealthy cholesterol levels. And that's generally defined as a low HDL, or what's commonly called the good cholesterol, or high triglycerides. So if you have of those signs, if you have at least 3 of those, you have metabolic syndrome. But if you have 1 of those, then you have a sign of metabolic disease. Now, here's why this is really important, is that this is an epidemic in our society now. Like this is what is most people are suffering with their health. It's also the thing that is driving the most common causes ultimately of death, meaning heart disease, cancer, dementia. Metabolic syndrome and metabolic disease is the underlying drivers of that. And just to give evidence to that, say, okay, well, where's your evidence come from that you say, okay, metabolic disease is a primary driver of heart disease? Well, one, we have mountains of evidence that show this, but one that I think is very compelling is when we look at people who don't have metabolic disease. So they have normal blood pressures, they have normal blood sugars, they have normal weight, they have normal cholesterol levels. Those people have 80% less heart disease than those of us who don't have a healthy metabolism, who have metabolic disease. So when we're looking at the root causes of things that kill us, heart disease, cancer, dementia, metabolic disease is prominently featured in that. 80% less heart disease in those people, about half the stroke risk for people that have a healthy metabolism, and a third less dementia and cancer. So does that make sense to you, Rylan? Like the why metabolic disease is actually the underlying driver or root cause of the diseases that we commonly associate with our end of life?
Oh, I'm muted. Sorry.
Yeah.
Oh, no. Common problem. No, definitely. It really makes sense to me. I've been looking into this a lot, of course. I mean, it's our job, but the typical diagnoses that we hear about all the time and that are like mainstreamed are these effects of metabolic syndrome. And we don't hear about metabolic syndrome itself as much. So I think we're inclined to think, oh, this is happening, I must have, high blood pressure or something like that. That's your first thought. We're not like conditioned yet to think about, okay, what's happening to my metabolism? And I don't know if this is like a mainstream thing for doctors to really discuss with their patients, is it?
Yeah, so that's a good question, and one that it's something that's well recognized in medicine, and particularly in the research and the literature. But what's interesting is it hasn't really translated into practice as often. Like I would commonly put in my patient assessments metabolic syndrome when people meet that criteria, but it's a rare thing for me to see a note from another physician and they note metabolic syndrome. And again, it's something that is, we tend to break it down into its component parts. The doctor might say, hypertension and dyslipidemia for cholesterol, and prediabetes or diabetes for sugar, or obesity for unhealthy weight, when actually they're all synergistic. They all work together, and they all work together in a way that leads to poor health for us and shortened life expectancies.
Yeah, yeah, absolutely. So I think that's a really important thing for everyone to understand, like just the connection between all of it. And then I'm curious, like, what percentage of metabolic problems are genetic, or are they largely like lifestyle driven? I don't know if you know
Yeah,
the exact number. I'm just kind of curious how that plays in.
absolutely. Genetics plays an important role in this, but so you're right. It depends on the population and what you mean by genetics and environmental. But I think that the number that I hear most frequently from other experts, and one that I would recognize, or I see in my practice and with our clients, I think it's about a 75%. It's choices.
Wow.
Environment, the things that people do, and about 25% of it is more in that predetermined genetics, aspect. So there are people that just have an unhealthy cholesterol level, they have high blood pressure, they're unhealthy weight, even though they're doing all the right things, even though they're, following a really good nutrition system, and they're physically active, and they're managing stress and sleep, avoiding toxins. But that's a vast majority. And I think probably even 75% is a conservative estimate. It may be even up to 90%.
Is a lifestyle.
Yeah.
Yeah,
Yeah. Yeah.
definitely.
And that's why, I guess the upshot of this. So why am I even talking about this? Why make that distinction between, heart disease and cancer and metabolic syndrome and metabolic disease and high blood pressure and its components? The reason that it's so powerful for people to know about this is twofold. Number one, healthcare alone is not going to be the best solution to healing your metabolism. I'm not disparaging the medications and healthcare's role in this. That's really important. And in fact, it's essential. If you're going to get the best care, expert medical care needs to be a part of that. But if you just rely on expert medical care, you're going to lose out on probably your best opportunity to get your metabolism healed and lower your risk of heart disease and cancer and dementia and all those things that we are most afraid of. The second part of this is that how powerful it is when you take that holistic approach to your health, to your metabolism, how powerful that is in helping you achieve your health goals, your weight goals, and your longevity goals. And we talked about this a little bit already, but as I said, the research shows us that when people can address those factors that are most impactful in their metabolism, they can lower their risk of heart disease by 80%, stroke risk by 50%, cancer and dementia by a third. And most people, a lot of people are not aware of that. They're not aware of the power that is in their hands that they can use to improve their health. And unfortunately, the system is they think the issue is their blood pressure, so they keep going to the doctor to say my blood pressure is high, and the doctor only knows one thing to do is, okay, here's a pill, right? Well, here's another pill. If that's not working, it may be in their 10 or 15 minutes they have with you, they'll say, if you could lose some weight and get some exercise and eat better and improve your sleep, that would be helpful. But it's not enough of a guidance, not enough framework or emphasis on that tremendous opportunity that people have. And that's kind of what I think is the most important point of all of this, is giving people the understanding of how much power they have to improve their health and their longevity.
Yeah, it's like even with, the time they don't have the knowledge, like your background story of like what's truly going on in your life. Like that never plays a role. Like experiences that you've had, eating habits, not even just eating habits, physical activity habits, sleep habits. There's so much complexity to what is you, and so much that makes up your metabolism that, the doctor can't come in and in 15 minutes and learn your life story and even address the root causes. The quickest way to fix it is a medication, which, like you said, is sometimes necessary, but there's also a lot of background to you and what is you and what makes up you and what's getting you the results that you're getting now. And I think root causes is such a strong word, because it's like, okay, these are the root causes of metabolic disease, but what's the root cause of those things causing your metabolic disease? What's at the heart of that? What is it truly? And a lot of times I think, well, at least I don't think I know, because I see it with our clients, is, it's usually a combination of a lot of things. And it usually has to do with not only physical things, but mental things that are going on as well.
Yeah, maybe, but probably the foundational issues, like how often do we see people who, one, believe that their problem is high blood pressure, for example, and but actually their real problem is that their metabolism is unhealthy, and they think the fix to that is either medications, and they'll say, oh, the medications aren't working for me, or I don't like taking these medications, or they're just not fixing the problem. And I know I need to eat better and exercise more. And that could be true. Like certainly those are really powerful tools, but actually the first thing that we need to get right with them is either sleep or stress. Like those are the factors that they're the mental aspects of their health that need to be addressed first before we can get to the other factors that are so important.
Yes, absolutely. Philip commented, and I hope you don't mind if I'm sharing your comments, but treat the disease, not the symptoms.
Yeah. So, this root cause, I realized, let me see if I should probably have a graphic that explains this better, but let's start with our top goal. Like what do we want to do? We want to live long, healthy lives, right? Like that's longevity. And what we know from studying the people that live a long time, the centenarians, the people that live to be 90 years of age, their secret is that they delay or avoid the common diseases that kill us. So if you want to look at it like, okay, well, what are the root causes of not living a long, vital life? Well, it's heart disease, cancer, dementia, diabetes, high blood pressure, these things. What are the root causes of cancer, heart disease, stroke, dementia? Is the root causes is metabolic disease. So it's high blood pressure, unhealthy weight, high blood sugars, unhealthy cholesterol levels. And then what are the root causes of metabolic disease? That's the 6 things that you can do that you can change those outcomes. So we're really doing root cause, like really drilling down.
Break it down. Yeah.
Exactly. And so, and there's 6 very powerful levers for impacting your metabolism, healing your metabolism. And those are nutrition, physical activity, sleep, stress, avoiding toxins, and then connection. So that's why we call our program and our content the Healthspan 10, because the 10 factors, the 4 aspects of metabolic syndrome, and then the 6 things, the root causes of metabolic disease, those are you optimize those 10 things. What's the result of that? You're dramatically lowering the risk of heart disease, cancer, stroke, dementia, and what's the result of that? Long, healthy, vital life. That's our complete message and program, really, in a nutshell, right there.
Yeah, very well stated. Very well stated. I think we need to create like a graph or something, like a visual to post. Let us know if you'd be interested in something like that. Kind of to break down what Dr. Hurst just said, all the way from, what's the ultimate goal of living a long life to, the secondary goal of delaying those diseases that kill us early, right? What those are, and then how we can delay those goals.
Yeah.
Or delay those diseases. Sorry, not delay the goals.
And I think so one, people, letting people know how much power they have in this, that I think it's been underrepresented. Everybody, like nobody that you ask, okay, do you think being active is important for your health? Everybody says, well, yes, of course. Do you think healthy nutrition is good for you? Yes, of course that is. But I think it's underemphasized how powerful those are. And because we can, by treating those root causes, getting down to the fundamental issues, you can imagine how there can be that cascade effect, not only up. So, for example, you eat healthier, which, improves your blood pressure, which lowers your risk of heart disease, right? But it also works synergistically across the line as well, because when you eat better, then you might sleep more. And then when you sleep better, your stress is better. And then when your stress is better, you're exercising more. Like all of those things are synergistic as well. So sometimes I think people can get overwhelmed and say, oh man, 10 things, like this is so much. I have so many things that I need to work on. But what we often do in our program is just bring them back down to say, okay, let's start with just one of these, because they really do work synergistically with each other. And it's just so exciting when we see people make small improvements in one area and they start seeing how those improvements can amplify over the other factors, and they start, accelerating their progress towards their health and weight and longevity goals.
Yeah, absolutely. And sometimes it's just, it's not something you think about every day. It's just opening your eyes to, okay, I have all these opportunities to feel better. Like it's like I didn't even realize I was sleeping so poorly, or I didn't even realize like I was having this many processed foods each day. Like this is such good news. It's not about like restricting or giving things up. It's like, hey, like I have this opportunity here that I didn't even notice. And it's amazing what I was talking about this with a client yesterday. It's amazing what small changes can do. Because if you think about it, if you're eating a certain processed food every day for years and years, so for every day for a year, and if you reduce that, like take that out, think about it on the scale, like the long-term scale of like a year, you've gotten rid of eating that food for 365 days, and that has results. Or adding just an hour to your sleep every night, like that's 365 more hours of sleep. So it's not about changing your entire life around and revamping what you do every day. It's those little changes and those little opportunities to look for that really are going to have the biggest impact, because they're actually doable and you're actually able to implement them into your life. And that's where you actually see results.
Yeah, that's so nicely stated. And I love that you brought up just being top of mind. Like that's been something that we've recognized from our successful clients. Like they appreciate the support. They appreciate the encouragement. They appreciate the clear path, like the clarity that we can give them on how to achieve their goals. But it's also at them recognizing later, saying, you know what, you kept this, what's really important to me at top of mind. Like, because life's busy for all of us. We're all distracted. We all have a million things going on. I don't know about you, Rylan, but I mean, this is my life and my business and my passion. And still life will get me off track from time to time. Like I get busy and I'm not as active as I want to be, or I'm not sleeping as well. But it's this, that reminder, because I can't forget about this. If I want to live a long, healthy life, and I do, and so do our clients, this is something that it's important to keep on top of mind. Like you got to battle that attention thing and not get distracted from what the real problem, the real thing that you want to accomplish is.
Yeah. And ultimately, like it has to be a priority. It's not really negotiable, because like if you don't have your health, like what do you have? Like nothing else is really worth it if, you're not at your absolute best. you're not your best you. And that comes with health.
Yep. And it's also exciting when people realize how much easier this is than they thought. Like once
Yeah.
that, how many times people say, "Oh, well, you can't help me. I've tried everything, and nothing works for me. I just don't have the motivation. I don't have the willpower." Whatever story they've told themselves, just like we all have our stories, and they realize, okay, well, you know what? Willpower isn't going to work for you anyways. Like this is what works. This is how we help you. And they realize not only is it so much easier than what they thought it was going to be, but how great it is to feel good again. Like, they almost have forgotten what it's like to have energy, to be excited about life, to not have to take so many medications that they're not excited about. And again, I'm not at any way saying, say goodbye to your doctor and just, address these issues. You need both, but man, you want to be on as little medications as you absolutely need to be on.
Yeah, 100%. And I'd say, if you are under the belief or you've had the experience that it's so complicated, like it's near impossible. Like I'm not going to say in like getting healthier, there aren't going to be moments of that are challenging to you. That is growth. You are faced with some discomfort and challenges and changes. But like if it's like to the point where you're hating it and you're uncomfortable, I would just say like point blank, you're making it too complicated. And like with your mind, like that's almost always what it is. Like it should not be this miserable, terrible experience, that's absolutely impossible for you. It's and even if you feel like you're doing the right things, usually it's some story, something in your mind that's keeping you from breaking from where you are to where you want to be and getting those results you want. So just wanted to throw that in there. A lot of times we make it more difficult than it needs to be. And so having
Absolutely.
someone to help you sort through that and just say, hey, look, like, stop thinking about all these other things, focus on this and trust yourself, believe in yourself, and learning how to do that is such an important process in this. And it's such a gratifying process too.
Absolutely. And again, and Rylan didn't say it in this way. She was emphasizing that this isn't a blame thing. Like nobody is saying, "Oh, well, you're flawed because you have stories." Truth is, we all have stories. I have stories. Rylan has stories. We all have false stories, and we need that external perspective from time to time to say, "Hey, is that really true?" Like, are you challenging that? And because especially those stories where we're holding ourselves back, because and it's universal, frankly. Like it's something that we all need. We all need that coach. We all need that somebody in our life that's just saying, okay, let's look at this a little bit more objectively. Is this really true? And I love that comment from our clients that are just killing it and completely changing their lives and their health. And they're like, I can't believe how easy it was. Like I just like it doesn't even feel like I'm working at this, and it's because they're doing things at their pace. We set it up, we go as fast as they want to go, but we also can support them and slow down and get them back on track when things go off the rails. We can help them with their stories, and in the end they're like, wow, that was easy. That was great. And once they have those tools, they never have to, like, it's not like you won't ever fall off the wagon again. You absolutely will, but you'll know your path back. Like you'll know what you need to do to get back on track.
Yeah, because like your story has changed from this sucks and this is hard to like, sorry, just to trail, like piggyback onto that. Like it all makes so much sense. I love when we discuss these things just because it's so true, but it's like, it becomes not difficult because you've changed your story. And so, and then you have that with you for the rest of your life, this new belief of what you're capable of, and this new belief of what is possible for you, and that you can, be free of XYZ issues and live a long life. It's almost like under each like lever that you have, like the nutrition, sleep, stress, physical activity, we could put like eliminate story, eliminate story, eliminate
Yeah.
story.
Yeah. Change your identity. I mean, that's another thing that we talk to people a lot
Yeah.
about, changing their identity, because they come with this identity of, well, I'm a overweight person, or I'm a person who hates exercise, or I am not going to do without my favorite foods or whatever. All those stories, and changing those identities is just so powerful. Like
Yeah.
I think really it's creating habits and changing identity. That's probably our most valuable contribution to our clients.
That's like the gist of it, really. Like you just said it right there, is like changing, like self-image, identity shift, and creating new habits. And believe me, like if you have a firm belief that number one, you can't do something or other, or nothing works for you, and that you have this self-image that this is who you are and it's not going to change, or you're genetically predispositioned to be this way, or your metabolism's permanently ruined, then your mind will find reasons and truths that make that true, that make those statements true. And until you can change that, that's always going to be your reality. So because what you believe is true, right? What you believe is your truth, is your reality. So until you can change that self-image and learn to see yourself as someone who's achieving the goals and getting the results and having longevity, then you will act accordingly.
Yeah, it's I guess it's easier for you and I, Rylan, to see that these things are holding people back, because we've seen the people that said, okay, look, I don't really believe in this yet, but I'm willing to give you a shot at it. Like I'm
Right.
willing to go all in, suspend my disbelief and really take this swing at it, because my health is too important to me. I have too many things in life that are, people are counting on me. I have a purpose I need to accomplish. I'm out of options. Like I really need to get this done. And when they were able to suspend that disbelief long enough to start seeing the progress, how it just completely changed them. And then, so we know that's possible. We've seen it many times, and it's so exciting when it happens.
Yeah, and that's actually super great point too, because there's like levels to it. You're like you're gonna wake up tomorrow and believe you're a different person, but it's that commitment right off the bat of like, I don't really have a choice anymore. Like this is non-negotiable for me. This is something I'm committed to, whether I feel like it or not, or whether work is stressful or not, like no matter the circumstance, like I'm going to do this for myself. And that's when, when you create that commitment, even if you don't fully believe it yet, that's when you start moving towards that new identity and that new person. And so it's like just placing your trust, which is scary, like placing your trust into becoming a new you and committing to it. And it's really, really powerful thing that you can do for yourself.
Absolutely. Well, I guess on that note, it seems like a good point, a good part to start wrapping up. So, what we talked about today is the number one cause of death is an unhealthy metabolism. And that's the root causes of heart disease, of cancer, of dementia, of stroke. And the best opportunities to treat your metabolism, to heal your metabolism, is address those root causes. And if you are looking to fix your root causes, if you're looking to heal your metabolism and you're interested in how we might be able to help you do that, I'd encourage you to schedule a strategy consultation with us. You get a chance to talk with Rylan, our expert health coach, and it's a very, very supportive conversation. We really just want to provide value for everybody that we talk with, understand what their goals are, and then give them the best guidance we can in how they can achieve their health and weight and longevity goals. So I'd encourage Anybody who is looking to heal their metabolism and is looking for expert guidance on how to do it, we're people that have done this and done it well and had success helping people just like you. So I encourage you to schedule a strategy consultation with us, and also encourage you to join us next week when we're going to take a deeper dive into one of those aspects, those root causes of an unhealthy metabolism, and that is sleep. And the title is, are your sleep habits killing you? So if you've struggled with your health at all, or you struggle with your sleep at all, well, one, you're not alone. That's at least half of the people indicate that they're not getting adequate sleep. But maybe how to tell, is that really impacting your health or not? That's what we'll talk about next week. This information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor. Thanks for watching, and if you want to learn more about living a long, healthy life you love, click the link below to learn more about how we help people increase their health span. And if you like this video, hit the like button below, share it with your friends, and be sure to hit the bell and subscribe.